I would say it's important to recognize what the role of navigators really is. I think it's important to know that the job of the navigators is it's not even just enrollment. You know, filling out the application and hitting the enroll button isn't the most difficult thing that navigators are doing. And I think when you so narrowly define their success simply by that, it's unfortunate because navigators they're helping consumers resolve some of their complex cases. You know, people that come to navigators for help are those that need help. So that they tend to be some of the most vulnerable populations. They tend to be, you know, populations that are hardest to reach. And so, you know, there are language barriers and literacy language barriers. So I think recognizing that you have to have navigators that are going out into rural areas where transportation is an issue. They're helping file exemptions if they don't qualify for APTCs. They are helping people understand health insurance. So a consumer doesn't always come in ready to, you know, here's all my personal information, hit enroll and select a plan. You're going through provider networks, you're going through formularies to see if the medications are covered under the different plans. You're spending time explaining the difference between coinsurance and co-payments and what the deductible is and how that will apply to your out-of-pocket costs. You know, they're filing appeals, they're doing SCPs, they're doing a lot of public education.
Appeals meaning special enrollment period applications.
I'm sorry, yeah, so special enrollment. So this is a year-long activity. First of all, doesn't just occur during open enrollment. And I think the other thing that's important to recognize is a whole lot of people apply because you have people going out into the communities doing that public education piece. So we reach a lot of folks by doing that maybe are confident in going home and filling out an application now that they know more about the program. So I think, first of all, it was unfortunate to so narrowly define the success of the navigators.
And let me just explain that, meaning that what the administration based each group's grant was on how many people it enrolled just in the marketplace plans, not helped enroll in Medicaid or did the kind of education that you're talking about.
Sure, you're connecting families to the CHIP program. You're also, you know, we get people in that do not qualify for the CSRs or the tax credits. So then what do? You want to help that person connect to health services in some way in the community. So the navigators do spend a lot of time trying to find out what resources can they help a consumer take advantage of, regardless of the fact that they're uninsured and they're going to remain uninsured.
Okay.
Just really, I mean, I'm going to be crass, is that some navigators do better jobs than others. That's true. And I think that, Jodi, look at the enrollment in Florida. Huge enrollment compared to Texas. I don't know the navigators in Texas, but Jodi's done a great job, but there are differences. But the other thing, we talk about navigators, about 5% of our enrollment is through navigators that we fund. 50% is through insurance agents. And when we talk about what's happening, I worry about health plans stopping paying commissions to insurance agents. 50% of our enrollment
which has been happening.
Insurance agents. Absolutely, it's happening. Yeah. We've got some plans, and like in Connecticut, I think, the 2 plans there are stopping paying commissions to insurance agents. That's a really bad formula. So we've got some questionable policies being happen federally, but also some of the health plans are making some dumb moves too. And luckily, states like Florida have really good health plans, like the Blue Cross of Florida. They aren't losing money. They're enrolling people. They're working closely with Jodi and navigators, but they're also working with the agent community. It's just, remember the whole spectrum of what it takes to get people enrolled.
Do you want to say anything about the plans or decisions?
Well, I think the decisions that are made around, you know, contractors or brokers is very dependent on how a plan is doing. If it becomes what they have to do to stay in business, then they'll change. And then some of them, I don't know that anyone, despite what you hear about insurance bailouts and otherwise, if you look, and there's been a couple of studies out recently about how the individual market is doing. First of all, they have an MLR requirement. Second, they also
explain what that is.
Yes, there are minimum ratios that you have to provide to direct care. And then there's a piece for administrative overhead. Many of these plans are break even at best. Some of them make a small margin, and many of them lost money and have exited the business. And so this insurance bailout for this segment of the industry is kind of like a dream. It's not reality. But there are folks who, I agree with Peter, you don't ever want to see agents and brokers cut out of the situation because they're very helpful, but sometimes that's done to keep a plan in business.